Thank you very much, dear Adriana. Let us move on with our agenda point in relation to this, and specifically with item 11, Emergency Medical Teams Regional Action Plan 2024 to 2030. All the relevant documents of this agenda can be seen on the screen, and the purpose of this session is to seek the support for the adoption of the Regional EMT Action Plan 2024-2030 and its related draft decision, which strengthens health emergency preparedness, response and resilience under the Preparedness 2.0 framework in the WHO European region. I would like now to give the floor to Dr. Gundo Weiler, our Acting Regional Emergencies Director, who will introduce us to this item. Dear Gundo, the floor is yours.
Yes, thank you, Dr. Denzer. I propose that we begin this session, as we've done with the previous sessions, by showing a video that highlights, in this case, the remarkable work done by emergency medical teams across the region. Additionally, the video will also reflect on the collective efforts of the EMT community of practice, which has played an instrumental role in shaping and developing this regional action plan in front of us. Please.
When crisis strikes, emergency medical teams, EMTs, are there, delivering life-saving care when and where it matters most. These teams form a community of practice, the EMT initiative, led by WHO, to ensure that patients in crises have access to quality care, while local health systems are reinforced with expertise and support. In the European region, this initiative unites over 85 teams, from those fully classified to those in training. Together, they form a regional health security safety net of over 75,000 highly trained medical professionals, ready to be deployed to emergencies at a moment's notice. In a world as unpredictable as ours, whether it's a pandemic, natural disaster, or ongoing conflict, one thing must remain certain: the availability of life-saving medical assistance. This growing need underlines the importance of strengthening national EMT capacities. In the centre of this effort is the Regional European EMT Capabilities Hub, or REACH, based in Turkey. By focusing on quality and capacity, REACH helps transfer knowledge and establish robust training and mentoring systems built on best practice and operational research in emergencies. This platform plays a leading role in improving national EMT capacities, ensuring that all teams meet WHO standards of care provision. It will also spearhead the implementation of the Regional Action Plan, guiding countries in building resilient EMT systems. The EMT Regional Action Plan 2024 to 2030 is more than just a framework. It's a blueprint for sustainable, high-quality EMT infrastructure. It adopts a cross-sectoral approach, addressing policies, training and collaboration across sectors to ensure all EMTs are equipped to meet any emergency. It's also about commitment. Countries play a vital role in creating supportive environments for EMTs by streamlining legal frameworks, facilitating swift deployments, and ensuring sustainable support for all phases of an emergency cycle. We are strengthening our collective ability to face the uncertainties of tomorrow, together, improving preparedness, building resilience, securing a safer future for all.
Thank you. Esteemed delegates, let me introduce to you Zinegul Azimbaya, whom you see here on the picture on the left side. By day, she's a paramedic in Kyrgyzstan, a lifesaver in her own right. But when disaster strikes, she steps into an even larger role by deploying with Kyrgyzstan's Emergency Medical Team, or EMT. Within 72 hours after the devastating earthquakes rocked Turkey in February 23, Zinegul and her fellow EMT members were on the ground, ready to save lives. Zinegul rescued 2 women from the rubble, one of them being pregnant, saving her and her unborn child's life. Many people received much-needed support in Turkey due to the work of national and international EMTs. In total, WHO coordinated the development of 38 EMTs, which represented the largest deployment of EMTs in WHO Europe's 75-year history. There are manifold inspiring stories from EMT deployments. During the COVID-19 pandemic, EMTs stood strong. In recent conflicts, they brought essential care to people in need, evacuated the severely injured, and bolstered national capacities to care and rehabilitate patients. These stories fill us with pride. EMTs embody our commitment to health for all. But there's a flip side to this story, a tragic one. It's the story when EMTs arrive too late, are unavailable, ill-equipped, or uncoordinated. Lives could have been saved, are lost. Today, we have an opportunity to act, to commit here and now so that no country bears the burden of a crisis alone, and no life is lost because help arrives too late or not at all. The success of EMTs in recent emergencies and the missed opportunities have brought their role in crisis response to the forefront of national agendas. EMTs are a key component of Preparedness 2.0, which you just approved in the previous session. Strengthening EMTs is as urgent as is their work. And this is why we have fast-tracked the development of the WHO Europe's EMT Action Plan to be the first mover under our new Preparedness 2.0 strategy. The plan is our shared vision to recognize and to regionalize the global EMT strategy, which was launched in 2022 in a global meeting in Armenia. It has the ambition to develop national EMT capacities and integrate them into health systems and make them more resilient. It ensures that, backed by international EMTs, countries will be prepared when the next crisis hits. The plan also holds promise to safeguard lives in years to come. EMTs also embodies a pledge of solidarity. Solidarity with those who are most affected by emergencies and solidarity between countries that come to each other's aid. But will this plan really make a difference? We believe it will. And we are confident because of 3 reasons. First, the EMT Action Plan has been shaped and co-created by those who know emergency medical teams inside, namely the EMT community itself. Second, the plan targets critical elements that we know will make a difference, and you will see them here listed on this slide. These include boosting commitment and a supportive environment for EMTs, fostering partnerships and reinforcing the EMT community of practice, ensuring coordination through information management, data sharing and digitalization, and providing a clear path for systematically increasing EMT quality and capabilities. Finally, we at WHO Europe have the expertise and capacity to support governments in the implementation process. Our regional medical team capabilities hub, or in short, REACH, you've heard it mentioned is located in our school, is ready to support member states, offering training and expertise needed to strengthen national EMT capacities. Alongside REACH, we have KeyMap, which stands for Knowledge and Information Management Emergency Platform. This is a digital platform that will coordinate teams in the field, monitor progress, evaluate results, and ensure accountability. It will keep us on track, making sure that we are actually achieving our goals. EMTs provide urgent life-saving support. I want to express my deep gratitude to you, our member states, for your active engagement throughout the consultation phase. The plan spells out clearly actionable steps that member states can take, alongside the support that you can expect from us here at WHO to ensure that stories like that of Sinegul become the norm and not the exception in the years ahead. So I want to thank you for your thoughtful consideration as you deliberate on the approval of this plan and for your unwavering belief that safeguarding health is the cornerstone of everything we do. With this, I would like now to invite Professor Johanna Hanefeld, who's sitting next to me, who's the Vice Chair of the Global EMT Strategic Advisory Group and who's also Vice President of the Robert Koch Institute in Germany, to share with us her perspective. Over to you, Professor Hanefeld.
Yeah, thank you very much, Gundo. Good afternoon, Chair, delegates, Regional Director, dear friends. So thank you for the introduction. As Gundo mentioned, my name is Johanna Hanefeld. I'm the Vice President of the Robert Koch Institute, Germany's National Public Health Institute, but it's a particular honor for me to address you this afternoon in my new role as the incoming chair of the Global EMT Initiative and to commend our European Action Plan to you. Over the past 5 years, we've not only witnessed a global pandemic, but we've also seen, especially since 2022, a rapid acceleration in the number of crises, in their complexity, often involving armed conflict, humanitarian emergencies, and health emergencies, and in their protracted nature. So we've witnessed this in our region, in Europe, but we've also, and breaking our hearts in a way, seen this in many other regions, including EMRO and also AFRO. And in these, what sometimes feels like really very dark times and moments, emergency medical teams and this network initiative provides life-saving, scalable quality care and critical health services when and where they are needed most. So we've seen that with over 85 EMTs in the WHO European region and more than 75,000 skilled health professionals, we've responded to countless crises from natural disasters to disease outbreaks. We've just heard of some of the crises already, and I want to join the remarks before, the recognizing what and adding condolences to Spain, but also knowing that first responders are helping there now. In addition, thinking about the initiative globally, Euro is really also a leader globally. So it's a regional initiative, but there's global leadership in this region. But I'm also speaking, and I'm doubly proud to present this action plan to you, not just as the chair of the global initiative, but also as the deputy head of Germany's National Public Health Institute. As National Public Health Institute, we are proud to host the National Focal Point function, which allows us in turn to support the vital work of the 6 German classified teams that we have as part of global health emergency response. And just as we are as proud as we are of our support to the global initiative. Our EMT colleagues were able to support and respond during Ebola in West Africa, in Turkey, in Ukraine, and in Gaza. Their technical skills and their humanity has allowed us to make a significant humanitarian contribution to the global health emergency architecture and to building that trust between all of our countries that we have learned is so vital to our preparedness and health protection. And this is the second point I wanted to make is really that it has a collateral benefit to our collective security. It's also enhanced our domestic readiness in Germany when we've had to respond to our own health emergencies, ensuring that our citizens benefit from the preparedness these teams bring. So for us, and from a national perspective, in some ways, they really are a sort of example of when you do the right thing, good things will follow. But to enable this networked quality care to work in an emergency response requires this networked approach. And that combines the national teams, as Gundo outlined, that we have and that we're building, and we're building this capacity in the European region, in the Euro region, embedded and trusted within their own communities, and then as part of a strong and growing international global initiative. And that's really what this regional action plan represents. It's our collective vision on how we build and strengthen the initiative, and it was mentioned this has been co-developed by all the teams coming together in the Euro region over a 2-year process to be able to offer that interoperable care across our region and as part of global health emergency and preparedness. So both an act of our collective safety, but also our humanitarian efforts. And you can see in the content of the action plan, there's a fair focus on coordination aspects and operations, such as the information system, information management system, KIMAP, that was mentioned, and sort of very, very concrete steps for us that enable us to deploy faster, more efficiently, and with required quality in the response. A key aspect of our strategy here is really on furthering this national EMT capacity. And we've really seen that the national capacity is the backbone in concert with the international EMT community of practice. This directly strengthens our capacity to respond collectively in emergencies, and most importantly, this is really also what saves lives. Ultimately, the regional EMT action plan reinforces what this network stands for. It's about solidarity between countries and about our shared humanity. A collaboration that protects the most vulnerable and saves lives in the very greatest and most pressing moments of needs. But to deliver on such a mission requires many things. So you need people, resources, partnerships, and trust, and they're all addressed within the document. But it really also requires this shared vision that's articulated there, and it needs to be supported by a roadmap that sets out the little steps and the details that bring us together and allow this work to come together to collectively deliver. And that's what the action plan represents. So I urge all countries to endorse the regional EMT action plan, to support our work going forward to 2030, and to join me to thank all the teams and the staff for the work they're doing in this region, but also for the world. Thank you.
Thank you so much, and for your support throughout the process. And really the co-creation of this plan by the EMT community cannot be overestimated. Thank you.
Thank you, dear Gundo. Thank you, Dr. Hannefeld, for this interesting insights on the EMTs. So with that, I would like to start the discussion on the agenda item 11, and I'm asking member states who would like to take the floor to raise their nameplates. And I see already some. Let's start with Hungary, please. You have the floor.
Thank you very much, Mr. Chair. Dear Regional Director, dear colleagues, I am speaking on behalf of the European Union and its 27 member states. I would like to emphasize our deep commitment to and support for the WHO Emergency Medical Teams initiative. Our commitment to this initiative is reflected in our continued financial and technical support, as well as our active participation in the deployment of the emergency medical teams. The EU remains dedicated to working collaboratively with WHO, its member states and key stakeholders to ensure that all nations, regardless of size or economic status, have the capability to respond swiftly and effectively to public health emergencies. We strongly support the new regional strategy in this key area. This initiative is not just a cornerstone of global health security, it is a beacon of hope for those communities across the WHO Euro region devastated by emergencies. The EMTs will help ensure that when disaster strikes, timely, quality, effective, and coordinated medical assistance is readily available, regardless of geographical boundaries. The new regional strategy marks a significant evolution of this initiative. By enhancing regional coordination, capacity building, and preparedness, it aims to create a more resilient and responsive framework for dealing with health crises. This strategy is particularly crucial in an era when the frequency and complexity of public health emergencies, determined by a large range of events, ranging from natural disasters to pandemics and armed conflicts, is increasing. The regional approach not only strengthens the global health security architecture, but also empowers local health systems to respond effectively to crises within their region, helping to ensure a faster and more culturally sensitive response to the needs and priorities of their respective communities. The European Union is proud to stand alongside WHO in this endeavour. In conclusion, the European Union firmly believes that though the EMT initiative and its new regional strategy, we and partners in the euro region can collectively enhance global resilience, save countless lives, and reduce human suffering. We look forward to continuing our partnership with WHO and other stakeholders to achieve these critical objectives. Thank you very much.
Thank you very much, Hungary. I would like to give the floor to Croatia, followed by Poland.
Dear Regional Director, dear Chair, dear colleagues, Croatia fully aligns with the statement from the European Union and strongly endorses the new regional strategy for emergency medical teams. This regional EMT strategy represents a significant advancement in building a more resilient and responsive framework to address health crises. It is essential for global health security, ensuring that medical assistance is swiftly coordinated and accessible during emergencies, regardless of location. As we mentioned already, the resolution proposed by Croatia on strengthening health emergency preparedness for disasters resulting from natural hazards, adopted at the 77th World Health Assembly with valuable cross-regional support, recognizes the importance of emergency medical teams and emphasizes the growing threats to global health due to the increasing frequency of natural disasters exacerbated by the climate change. At a time when public health emergencies, whether arising from natural disasters, pandemics, or armed conflicts, are becoming more frequent and complex, this regional approach under the EMT strategy strengthens both the global health security structure and local health systems' capacity to manage emergencies. Croatia remains dedicated to working closely with WHO, its member states, and other stakeholders to ensure that all nations, regardless of their size or economic capacity, are fully equipped to respond quickly and effectively to health emergencies. In conclusion, Croatia believes that the EMT initiative and its regional strategy will enable a more timely and culturally sensitive response to the distinct needs of various regions. We look forward to continued cooperation with WHO and other partners to achieve these important objectives. Thank you.
Thank you very much, Croatia. The next one would be Poland, followed by Israel. Poland, the floor is yours.
Thank you, Chair, Regional Director, colleagues. Poland fully aligns with the statement of the European Union and its member states. Despite rapid technological development and progress in resolving many social and political issues, today's world and even our region is not free from political instability, poverty, and natural disasters, all resulting in serious humanitarian crises. In the view of all that, the necessity of having an emergency preparedness and response plan is crucial, and the Emergency Medical Teams initiative is more than needed. Poland welcomes the EMT Regional Action Plan. We are convinced that it will contribute to strengthening the EMT initiative, elaborating directions and procedures which will help European EMTs to act in a more structured and consistent manner. At the same time, it is universal enough to be used by all 53 member states of the European region. The capacity to activate and coordinate rapid response in the immediate aftermath of an emergency situation is very much needed, as we can expect that health emergencies will become increasingly frequent, severe, and intertwined in the coming decades. That is why Poland actively develops its capacity to react through EMT's mechanism, supporting 3 new teams in WHO certification process. On behalf of our national focal point for EMT, I can declare our continuous support to the initiative. Last year in Astana, Poland highlighted engagement of the Polish EMTs in response actions for the COVID-19 pandemic, the war in Ukraine, and the earthquakes in Turkey and Syria. Today, the eyes of the whole world are on the Middle East. The Polish experts are constantly present in EMTCC in Cairo since January 2024, participating so far in 10 rotations and planning to continue this engagement. They have provided EU ERCC with their knowledge and experience as medevac and medical experts, technical and business support officers, and deputy coordinators. The WHO-certified EMT, Polish Center for International Aid, manages the medevac hub Jasionka, used for evacuation of Ukrainian patients. The multiplying crisis situations require increased efforts. This may be overwhelming, but our principle is to leave no one behind. Our Hirotho experience has strengthened us, allowed us to develop working solutions, and we are increasingly better prepared to respond to crisis situations. In light of two ongoing conflicts in the Euro region, Poland strongly urges member states to continue their support for people affected by emergencies and to alleviate the aggravating humanitarian situations in Ukraine and Middle East. Thank you.
Thank you, Poland. The next one is Israel, followed by Bulgaria.
Thank you, Chair. Israel welcomes the action plan and fully supports its implementation. Israel is honored to lead a knowledge-sharing community in this effort. Indeed, we are happy to have our proposal to establish a collaborative center with an academic partners exactly on this topic. The action plan is a good opportunity to implement the strategy set out in Armenia to strengthen the role of national focal points. The Israeli Ministry of Health supports the process of requesting assistance exclusively through EMT Secretariat platform as a main way to ensure orderly arrival of aid and ensure professional quality. The relevant national focal point should be the main address for operational activity. We support the performance to receive only EMT classified teams in order to simplify the process of accepting aid and ensuring quality. In order to further the implementation of this strategy, we propose establishing a web-based community of national focal points with EMT Secretariat with the goal of sharing lessons learned following activities, practical tool experience and knowledge. This will serve countries well in learning and sharing information on this classification process. We also suggest enhancing communication among national focal points to provide real-time assistance with the EMT Secretariat with the goal of providing good active online for national focal points during crisis, including in real time. Looking ahead, Israel is interested in serving as a teaching example for further strengthening the civil health emergency response partnership and improving interoperability in light of our 30 years of experience, and together we could do much better. Thank you very much.
Thank you, Israel. The next one would be Bulgaria, followed by Norway.
Honorable Chair, distinguished Regional Director, Excellencies, Bulgaria aligns itself with the EU statement made on behalf of the EU member states. In Bulgaria, the emergency healthcare system has always been considered an integral part of the national health system. In line with WHO resolution WHA 72.16, calling on member states to establish policies for sustainable financing, effective management, and universal access to safe, high-quality, needs-based emergency care for all, and to support efforts to ensure that emergency medical teams are protected from violence and patients from discrimination, all strategic documents adopted over the years to date, including the National Health Strategy 2030, have emphasized that the availability of a well-functioning integrated emergency care system is fundamental to the health system transformation process and ensures its sustainability. There is a specific policy addressing emergency preparedness response resilience formulated in the National Health Strategy 2030, that is, development of emergency care and emergency response capacities, where it is explicitly highlighted that the opportunity of cross-border cooperation will also be used to support the capacity of the emergency medical care system through the development and implementation of coordination protocols and mechanisms for inter-agency collaboration. The focus of this policy is on providing the necessary skilled human resources, motivating remuneration and working conditions, sustainable financing, upgrading and maintaining infrastructure, upgrading their emergency capabilities, implementing telemedicine, maintaining and developing communication and information support for the effective organization, coordination and management of the integrated emergency medical care system. Bulgaria appreciates and supports the proposed framework for action and the overall vision of the proposed guidelines, as well as the draft decision to approve the Regional Action Plan for Emergency Medical Teams for the period 2024-2030. We believe that the implementation of the actions to achieve the set objectives will improve the health of citizens on one hand and improve the quality, resilience, sustainability, and integrity of national health systems on the other, thus contributing to regional and global resilience. Thank you.
Thank you, Bulgaria. The next one would be Norway, followed by Belgium.
Regional Director, dear Excellencies, I honor the statement on behalf of Denmark, Estonia, Finland, Iceland, Lithuania, Sweden, and Norway. The Nordics consider the new Emergency Medical Teams Regional Action Plan as a valuable tool for Member States to implement global emergency medical teams vision for the 2030 in the region, in alignment with the Global Health Emergency Corps and the Regional Preparedness 2.0 strategy and action plan. It's important that the work is well aligned with WHO Global Outbreak Alert and Response Network and relevant EU initiatives and structures. It's our assessment that the proposed plan will support Member States in their efforts to ensure that populations affected by health emergencies have access to quality, life-saving and essential health services through effective, scalable, interoperable and rapidly deployable EMTs, along with other emergency capacities that are fully integrated into resilient national health systems. We would like to underline the importance that EMTs deployed in countries contribute to strengthen national capacities for the long run. In this regard, a regional approach is crucial to ensure EMTs that understand the local and national context in which they operate. Overall, we see the Regional Action Plan as an important step to increase our resilience and support our national, regional, and global emergency preparedness and response, and we look forward to engaging in the process to reach the 2030 goal. Thank you.
Thank you very much. The next one will be Belgium, followed by Lithuania. Belgium, the floor is yours.
Thank you, Chair. Director General, dear colleagues. Belgium fully aligns itself with the statement delivered by Hungary on behalf of the EU and its member states. We thank the Regional Director, Dr. Kluge, for proposing this new action plan that responds to the need expressed during the previous Regional Committee meeting last year. The European region has been hit the last 4 years by a large variety of public health emergencies. The COVID-19 pandemic, the negative health impacts of the triple planetary crisis, and of natural hazard and armed conflict. Those adversities demonstrated the urgent need to further develop and sustain our preparedness and response plannings at national, regional, and global level, as well as to ensure the resilience of our health systems and of our population. Strengthening prevention, preparedness, and response capacity and integrating health emergency capacities into resilient national health systems is key priorities in all countries. In complement to national capacities, effective, scalable, interoperable, and rapidly deployable EMTs are instrumental in supporting member states in their efforts to ensure that populations affected have access to quality, life-saving health services. As active partner of the Emergency Medical Team Initiative since many years, Belgium welcomed this new action plan for 2024-2030 and would like to express its full support and endorsement. Much progress has been achieved in key areas of work over the past years, such as in governance, capacity building, and digitalization. We are confident that this new action plan will bring many additional opportunities of collaboration between the member states and support the effort to guarantee that populations affected by emergency timely access to quality essential health services. We look forward to continuing our collaboration with WHO and the member states of the European region. Thank you.
Thank you, Belgium. On the list would be Lithuania, followed by the United Kingdom.
Thank you, dear Regional Director, Chair, colleagues. Lithuania fully agrees with the statement made by Norway on behalf of EU and its member states. On behalf of the Ministry of Health of Republic of Lithuania, I would like to express our full support to EMT Regional Action Plan. We acknowledge the importance of this plan as a framework for coordinated actions to strengthen emergency response capacities across the region. The Ministry of Health participates actively in the implementation of this action plan. The EMT initiative plays a vital role in national health emergency planning and preparedness and is fully supported by the government of Lithuania. EMT will strengthen our infrastructure of national security and strengthen the health system's readiness to respond to various threats. Lithuania's emergency medical team is already prepared to become a member of EMT community. We are determined to achieve official EMT certification in upcoming 3 months, ensuring that our team can contribute effectively to the collective health security efforts, both regionally and globally. We look forward to a strong partnership and reinforcing our shared commitment to health emergency preparedness.
Thank you very much, Lithuania. The next one would be the United Kingdom, followed by the Russian Federation.
Thank you, Chair. Regional Director, distinguished delegates, the UK would thank the WHO Secretariat for coordinating the development of the EMT Regional Action Plan. The process has provided clarity to Member States in the region on the role of EMTs, and the UK remains open to further discussion on their role. The UK is glad to endorse the Regional EMT Action Plan from 2024 to 2030 and to reiterate its commitment to continued support for the delivery of quality healthcare in humanitarian contexts. This action plan will help ensure that technical expertise can be deployed and learning shared effectively through a coordinated mechanism when needed to protect lives and livelihoods from health impacts of all hazards that pose a risk in the region and beyond. Thank you.
Thank you very much. Next will be the Russian Federation, followed by Iceland.
Уважаемый господин председатель, уважаемый региональный директор, коллеги, в Российской Федерации отчаянной медицинской помощи используется формирование Всероссийской службы медицины катастроф, полевые госпитали, отряды, бригады экстренного реагирования и бригады специализированной медицинской помощи. Российские бригады играют важную роль в оперативном оказании медицинской медицинской помощи в условиях кризисов как внутри страны, так и за рубежом. Федеральный центр медицины катастроф Минздрава России в 2023 году принимал участие в ликвидации медико-санитарных последствий чрезвычайных ситуаций на территории Сирийской Арабской Республики и Турецкой Республики. Высокие стандарты и оснащенность позволила двум российским бригадам, одним из первых в мире, пройти процедуру сертификации ВОЗ. И одна бригада сейчас находится в процессе прохождения оценки. Уникальной российской разработкой, которая уже более 50 лет, являются мобильные противоэпидемические лаборатории Роспотребнадзора. Они были созданы в 60-х годах прошлого века и сегодня постоянно модернизируются. Мобильные лаборатории имеют высокий уровень биологической защиты, оснащены самым современным оборудованием для диагностики инфекций и могут в течение 24-48 часов быть доставлены в любую точку мира для ликвидации ситуации санитарно-эпидемиологического характера. И за 10 лет 35 мобильных эпидемических лабораторий передано Роспотребнадзором в 14 стран мира. И они успешно применяются при массовых мероприятиях для усиления санитарно-карантинного контроля, при реагировании на чрезвычайные ситуации санитарно-эпидемиологического характера как внутри страны, так и за рубежом. Россия провела 15 совместных учений по реагированию чрезвычайных медицинских бригад на вспышки инфекций. Причем крупнейшее такое мероприятие, в котором приняло участие 150 специалистов из 26 стран, состоялось в начале октября этого года в Нижнем Новгороде. Наши чрезвычайные медицинские бригады имеют статус бригад ВОЗ. Мы активно работаем с организацией, в том числе по сети предупреждения и реагированию на вспышки. В этой связи благодарим секретариат за разработку регионального и поддерживаем его принятие. Спасибо.
Thank you very much, Russian Federation. The next on the list is Iceland, followed by Turkmenistan.
Thank you, Chair. Regional Director, committee members. First of all, I would like to start by expressing our solidarity to Spain. Secondly, Iceland fully supports the statement delivered by Norway on behalf of the Nordic Baltic countries. In Iceland, we believe that we have a well-developed emergency response system that coordinates multiple agencies for natural disasters and other emergencies. But we do not have a dedicated national emergency medical team. Earlier this year, the Minister of Health appointed a preparatory group tasked with examining the feasibility of establishing an EMT in Iceland. The group recommends the establishment of an EMT Type 1 in Iceland, specialized in operating in cold regions, with the possibility of applying for World Health Organization certification. The WHO's role in facilitating the technical support for member states and enhancing the regional capacity and cross-border cooperation is of vital importance. Iceland is committed to the EMT Regional Action Plan and looks forward to collaborating with WHO and fellow member states in building a stronger, more responsive emergency system than we have today. Thank you.
Thank you very much, Iceland. Now followed by Turkmenistan, and after that, Germany. Turkmenistan, you have the floor.
Благодарю за предоставленную возможность, уважаемый председатель. Прежде всего, позвольте присоединиться к предыдущим выступающим и выразить слова соболезнования Испании, отдельно семьям и близким пострадавших. Уважаемый региональный директор, коллеги, позвольте подтвердить, что Туркменистан поддерживает инициативы Европейского регионального бюро ВОЗ в области укрепления глобальной архитектуры, обеспечения готовности, реагирования и повышения устойчивости к чрезвычайным ситуациям в области здравоохранения, включая разработку регионального плана действий в отношении чрезвычайных медицинских бригад. Считаем, что данный документ послужит комплексной и широкой основой для скоординированных действий, обеспечит укрепление национального и регионального потенциала реагирования на чрезвычайные ситуации в области здравоохранения, позволит выстроить структурированный путь для совместных действий и сотрудничества, поспособствует привлечению необходимого финансирования в области обеспечения готовности. Полагаем, что общее одобрение данного плана шагом в укреплении роли инициативы ЧМБ в качестве ключевого компонента комплексного плана позволит обеспечить своевременный доступ к качественным, жизненно необходимым услугам здравоохранения силами эффективных, масштабируемых, функционально совместимых и быстро чрезвычайных медицинских бригад и других ресурсов для действий при чрезвычайных ситуациях, в полной мере интегрированных в национальные жизнестойкие системы здравоохранения. Внедрение в национальные планы обеспечения готовности и реагирования норм и стандартов, разработанных в рамках инициативы, поспособствует укреплению и развитию потенциала в этой области. На уровне страны в данный момент предпринято ряд мероприятий, организованы несколько консультативно-технических миссий, назначен национальный координатор, создана рабочая группа, и сейчас начата работа по изучению возможностей создания национальной чрезвычайной медицинской бригады. Позвольте заверить, что мы готовы сотрудничать и дальше в этой области. Благодарю за внимание.
Thank you very much. Next one would be Germany, followed by Spain. Germany, the floor is yours.
Thank you, Chair. Germany fully aligns with the statement delivered by Hungary on behalf of and its member states. Germany would like to express its full support for the new regional strategy on the EMT Initiative Regional Action Plan 2024 to 2030. This strategy strengthens the critical regional action and capacity building in this area while providing a sustainable framework for both current and future health crises. The importance of EMTs and international health emergency response cannot be overstated. The success of the EMT initiative depends greatly on the commitment of both governmental and non-governmental organizations. We are proud that German EMTs and the EMT National Focal Point are playing a crucial role in the implementation and the establishment of an active community of practice. We are convinced that the continuous development of national and international EMT structures is essential to enhancing the ability to resolve health crises, and that collaboration with networks such as GOAN must be further supported and reinforced. Working in synergy with WHO and our national and international partners, the new regional strategy and action plan ensure that we can respond to crises not only more rapidly, but also with greater differentiation. Through close collaboration within our regions, we ensure better access to minimum medical standards and more efficient use of resources, allowing us to save lives and alleviate human suffering during crises. Germany is firmly committed to these objectives and remains dedicated to actively contributing to the successful implementation of the regional strategy. Thank you.
Thank you very much, Germany. Next one is Spain, followed by Czechia.
Thank you, Chair. Dear Regional Director, colleagues, Spain aligns with the statement made by Hungary on behalf of the European Union. Spain fully supports this action plan, The emergency situation caused by the floods in Spain this week is yet another example of why all member states should work together for a coordinated implementation of emergency medical teams through this action plan. Spain has currently multiple roles within the AMT initiative through the Spanish Agency for International Development Cooperation, AICID, attached to the Ministry of Foreign Affairs, European Union and Cooperation in collaboration with the Ministry of Health. There are currently 2 Spanish EMTs classified with WHO, AICID Type 2 EMT and SAMUR's Type 1 EMT, as a result from the collaboration between AICID, the Ministry of Health, and the autonomous communities. And there are others in the process of our considering classification. These teams and the staff from these teams have deployed internationally as part of response to emergencies under the WHO umbrella, both as emergency medical teams, for example, Mozambique in 2019 and Turkey in 2023, and as second experts to EMT coordination centers, for example, EMTCC Cairo for the Gaza response in 2024. In addition to this, they have participated in trainings and mentoring programs for other EMT teams. Since the kick-start of the EMT initiative, especially since 2016, AICID has contributed both to the global EMT initiative from WHO and the EMT initiative in the Americas, with approximately 250,000 euros each year for each of 2 initiatives. One expert from AICID is part of the Committee for the Euro region for the period 2024-2027. Spain has shown a strong commitment to the EMT initiative since its creation and has collaborated closely with WHO to enhance the global EMT framework, demonstrating its dedication to global health security and humanitarian assistance, supporting efforts to save lives and reduce suffering during emergencies worldwide. In line with this and with its commitment to enhancing its health system's resilience, ensure it can respond swiftly and effectively to future health crises. Spain, we would like to endorse the AMT Regional Action Plan 2024-2030. By thanking this regional commitment for all the... Thank you.
Thank you very much, Spain. Move over to Czechia, followed by Ukraine. Czechia, you have the floor.
Thank you for giving me the floor. General Director, distinguished delegates, ladies and gentlemen. The Czech Republic aligns itself with the statement delivered by Hungary on behalf of the European Union and its member states. The Czech Republic would like to express a deep appreciation to the WHO for the work on the Emergency Medical Team's Regional Action Plan for 2024-2030. We fully agree that strengthening the resilience of national health system, especially in these times of ongoing crisis, is of the utmost importance. The Czech Republic is currently working on establishing EMT Grade 1. We hope to achieve its classification soon, thereby enabling us to integrate fully into the EMT family, not only within the European region, but within the entire system. We also value the flexibility given to Member States in implementing the recommended measures, particularly regarding the establishment of national EMT. In very specific context of some countries, including the Czech Republic, the creation of national EMTs might seem redundant and inefficient. Therefore, we appreciate the WHO's respect for the unique structures of national health systems. Given the importance of the Regional Action Plan, the Czech Republic fully supports the adoption of the respective draft decision. Thank you for your attention.
Thank you very much. The next one would be Ukraine, followed by Armenia. Ukraine, you have the floor.
Thank you for the floor. Your Excellency, Chair, dear colleagues and delegates, we are honored to support the proposed draft resolution to review the WHO Regional Action Plan for Emergency Medical Teams for 2024-2030. Ukraine is also uniquely experienced in organizing healthcare under conditions of conflict and large-scale crisis, which offer as a contribution to strengthening the EMT system in our region. This experience includes national coordination and readiness. Ukraine has developed national platforms for the rapid distribution of medical resources, reducing the time required to deliver medicines and equipment to crisis regions. Our national emergency medical teams can be deployed to assist populations regardless to geographical location, aligning with the EMT regional plan's goal of strengthening national health system. Intersectoral mobile medical teams and digital monitoring. In Ukraine, mobile medical teams have been created, equipped with the digital tools to track disease spread, monitor patients' health, and rapidly respond to threats. These tools enhance coordination and the quality of services in critical situations, allowing data sharing across regions for quick decision-making. Medical team training and international cooperation. Ukraine actively collaborates with international organizations, including, of course, WHO and the International Red Cross, to train emergency medical teams according to best global practice. This collaboration has equipped our specialists with diverse crisis management skills, allowing us to better meet regional needs. Based on our experience, we propose the following practical measures for the EMT Regional Action Plan. Strengthening national capacity in crisis regions. We believe in developing local mobile medical hubs to more effectively meet the needs of affected population and provide medical care as quickly as possible. Creating regional reserves of medical resources and essential equipment across different regions to ensure rapid supply when needed. This approach helps maintain uninterrupted healthcare services and prevents resources storages during crisis. Supporting psychological assistance in crisis situation. Given the profound psychological impact of the population, we have developed effective mental health support programs. Its experience with regional partners and support their implementation of the action plan. We believe that close cooperation, knowledge sharing, and resource pooling will enhance to regions' crisis readiness in the European region and establish renewable response system capable of protecting and assisting those in need. Thank you.
Thank you very much, Ukraine. The next one would be Armenia, by the Republic of Moldova.
Thank you, Chair. Distinguished Regional Director, dear ladies and gentlemen, as we are approaching the end of the European Programme of Work for 2025, it is a unique opportunity to jointly reflect on our shared commitment for collectively strengthening health emergency prevention, preparedness, response and resilience, highlighting the achievements, tackling the challenges, and moving forward. In this respect, Emergency Medical Team's Regional Action Plan is the very document that paves a smooth path recommending actions to create favorable conditions for the development of national and international EMT capacities and capabilities, plan that serves as a comprehensive framework for coordinated actions over the next 6 years as a critical step in reinforcing the EMT initiative's role and as a cornerstone of national health emergency planning aligned with the global EMT 2030 strategy. Due to its epidemiological and public health risks profile with public health hazards such as armed conflicts, natural disasters, mainly earthquakes, being prominent, as an emergency-prone country is passing its way trying to provide timely and locally appropriate responses in any health emergency, doing its utmost to strengthen the resilience of its health system. As recent and a vivid example I can bring, the influx of more than 120,000 forcibly displaced refugees from Nagorno-Karabakh to Armenia highlighted the need of further strengthening of Armenia's health emergency preparedness and response capacities. Hundreds of civilians were killed, wounded as a result of damage caused by the fuel depot blast in Nagorno-Karabakh in 2023 in the situation of mass displacement. Thanks to all those internationally deployed to our country WHO specialized care teams who have stood next to us, working alongside the local healthcare personnel, many burn patients' lives were saved. The EMT's integration with the local medical professionals was pivotal to this mission's success. This was the first time the EMT initiative had capacity building training as a part of the exit plan for EMTs to be delivered collaboratively rather than individually. Drawing on the collective expertise of the existing EMTs provided the possibility to deliver a high level of training of trainers for burn cases, resulting in a wider reach to strengthen health systems over the coming months. As the saying goes, no humanitarian step and support goes unanswered, realizing the importance and role of creating quality surge medical capacities to respond rapidly to emergencies with health consequences in Armenia at a national as well as at subnational level. The Ministry of Health undertook an initiative of establishing its governmental emergency medical team, hopefully to be classified by the end of this year. Global experience shows that having a trained EMT workforce enables delivery of high-quality healthcare assistance in critical situations. So let us unite our efforts for high standards of care in emergencies, transforming examples into opportunities. Armenia fully supports for the EMT regional act for 2024-2030. Thank you very much.
Armenia. Next one would be the Republic of Moldova. You have the floor.
Thank you, Chair. Honorable Regional Director, distinguished guests. The Republic of Moldova fully supports the EMT Regional Action Plan. This plan represents a critical step towards enhancing the resilience and responsiveness of our health systems in the face of emergencies. The focus on EMT development aligns closely with our national strategy to strengthen health emergency capacities, to improve interoperability and foster collaboration with our partners across the WHO European region. Moldova has enhanced its emergency response capacity with the new ambulances and other medical equipment, capacity development in the area of emergency medicine and clinical care, though a shortage of specialists remains a key challenge. Our National Center for Emergency Pre-Hospital Medical Assistance has its own training center where WHO provides expert consultations, training of trainers to ensure interoperability and seamless transfer of expertise and technologies between our country and the other states from the region, ensuring robust and collaborative response to emergencies. We are actively working to strengthen Moldova's EMT's capacities through the best international practices, conducting specialized trainings, and developing a specialized curriculum to improve our national EMT capacities. We recognize the importance of this comprehensive approach, which emphasizes technical support, monitoring, and knowledge exchange as essential components for successful implementation. Moldova remains committed to working in a partnership with WHO and other member states to achieve the objectives of the EMT Action Plan, thereby ensuring that our healthcare systems can effectively respond to future emergencies. I thank you for your attention.
Thank you very much, Republic of Moldova. I don't see any other nameplates raised, so I assume that we can now move on to our partners. So any partners who would like to ask the floor, please raise your nameplate. And we could maybe start and giving the floor to the International Federation of Red Cross and Red Crescent Societies.
Thank you, distinguished Deputy Executive President, esteemed Regional Director, Excellencies, delegates, ladies and gentlemen. Thank you to WHO Europe for presenting the EMT Action Plan for 24 to 2030. This comprehensive and strategic roadmap is a crucial step towards regionalized, resilient health systems, and we firmly believe that true localization of emergency medical response will only be achieved through strong regional frameworks and partnerships. The International Federation of Red Cross and Red Crescent Societies in Europe, with its 54 national Red Cross or Red Crescent national societies, is fully committed to supporting the aims of this action plan. Our decades of experience in deploying medical emergency response units that meet WHO EMT standards, thanks to the Global Red Channel Agreement between IFRC and WHO, underscore our alignment with the EMT initiative's high technical standards, accountability, and coordination measures. The Red Channel Agreement formalizes the IFRC's emergency response units within the WHO EMT classification and enhances our readiness to deploy rapidly with consistently high quality, impactful care. As auxiliaries to the governments and deeply rooted within communities, the national societies bring a unique approach centered on principled humanitarian action. Guided by our fundamental principles of humanity, neutrality, independence, and impartiality, we are dedicated to reaching all people in need, regardless of political, religious, or ideological differences. These principles enable us to operate independently and impartially, which often grants us access to areas that may be inaccessible to others. In some cases, we are the only or best option to deliver emergency medical support where other EMTs may face operational limitations or lack the necessary trust from affected communities. In collaboration with governments and WHO Europe, I think we can ensure that vital medical assistance reaches those most in need, especially in those contexts where our neutrality and impartiality opens doors that may otherwise remain closed. I thank you.
Thank you very much. Any other nameplates raised? So I would like to move on to the NSAs and the Secretariat. One request for a joint statement by the International Council of Nurses on behalf of the European Forum of National Nurses and Midwives Associations, the European Nursing Students Association, the European Federation of Nurses Association. Please, you have the floor.
Thank you, Chair. On behalf of signatories, we strongly support the adoption of the EMT Regional Action Plan 2024 to 2030, which regionalizes the global EMT 2030 strategy. This action plan aligns with the Sustainable Development Goal 3D, focusing on emergency preparedness and national health workforce, implements the ICN core competencies in disaster nursing for families. We believe that the approval and implementation of this regional action plan will significantly enhance EMT capabilities, including nursing and midwifery disaster competencies across the European region. The development of advanced competencies in nursing and midwifery and implementation teams are crucial for improving emergency health capacity response across the European region. Therefore, we emphasize the importance of investing in education and regular training professionals to ensure preparedness and competence in responding to humanitarian emergencies and disasters, including nursing and midwifery representatives in planning structures and processes to ensure effective coordination and response. And last, enhancing EMT interoperability between government organizations, Defense Health Department, and NGOs to strengthen health emergency preparedness and response. We urge the adoption of this strategy to promote the systemic uptake and use of the EMT Regional Action Plan and guidelines, improving emergency response capabilities at national, subnational, and regional levels in line with the agreed minimum standards. This will ultimately enhance access to quality health services for populations affected by crisis through effective, scalable, and interoperable medical teams that are fully integrated components of a resilient national health systems. By adopting this regional action plan, we can strengthen health emergency preparedness and response, ensuring better cooperation within countries and a more effective response to humanitarian emergencies and disasters. Thank you.
Thank you very much. The next one would be the International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, it is an honor to speak on behalf of the International Pharmaceutical Students Federation European Regional Office, represents over 150,000 pharmaceutical students and recent graduates in over 37 countries. Addressing health emergencies rely on the country's preparedness and the agility of their healthcare systems. It has been 5 years since the COVID-19 pandemic influenced all of our lives. It not only substantiated the interdependence of health and socio-economic stability, but also served as a strong reminder of the importance to surge capacities in responding to infectious disease outbreaks in vulnerable regions. Therefore, IPSF Euro fully supports the EMT Regional Action Plan 2024-2030. In light of this pandemic, IPSF Euro has been advocating for meaningful youth engagement during health emergencies and partnered with healthcare student organizations, ensuring a One Health approach. Additionally, as the COVID-19 pandemic has tested global health systems to their limits, pharmacy professionals have shown themselves to be an integral part of them. Pharmacists are the most accessible healthcare providers and ensure medication safety and utilize evidence-based practice in both clinical and community settings. In that regard, IPSF Euro calls the WHO and its member states to fully utilize pharmacists' potential emergencies and adopt a patient and community-centered plan based on humanitarian principles. We also acknowledge the importance of capacity at all levels of the healthcare system for emergency preparedness and to recognize and authorize pharmacists expanding responsibilities during health emergencies, such as following them to administer vaccinations at community level, ensuring rapid accessibility in urban and remote settings. Lastly, IPSF Euro urges WHO and member states to integrate diverse stakeholders such as civil society organizations and youth in their EMT plans for an adaptive, sustainable preparedness plan. Thank you.
Thank you. And with this concludes our discussion, and I thank all the speakers that were taking the floor, and I would like to invite the Secretariat for the response, and maybe we can start with Dr. And
yes,
followed by the Regional Director.
And thank you to all of you for the rich statements and for your very strong support to this strategy, underlining really the outstanding role that EMTs play as a central piece in our emergency preparedness architecture. I think we are also seeing that strong support because this strategy is a very good example of a particular way of creating such strategies through co-creation between the doers, which is the EMT community, the communities who are benefiting from EMTs, and also the policymakers. Many countries have taken the floor today who are actually very active in also deploying EMTs, who've done so in the past, who are doing it as we speak right now, and I really want to appreciate that and thank you all for that. In your comments, you've pointed to 3 critical aspects of emergency medical teams. The first one is that indeed there are a highly visible support that translates into immediate life-saving interventions provided by the intervention of the first responders, or as I think the colleague from the EU said, they are indeed a beacon of hope for the most vulnerable. The second reason is that indeed, as we also see EMTs, beyond this immediate life-saving support, they can also be seen as driver for strengthening national health systems. And we've seen many examples how EMTs have contributed to health system transformation. And I think our colleague from Moldova pointed to one of them, also our colleague from Armenia, specifically with regard to the contribution of EMTs to fostering rehabilitation capacities for burn victims. And the third role is that there are also very visible signs of collaboration and of solidarity between countries. And I think it's this combination of the three that makes this EMT strategy so important and this movement so important. So you've pointed to various aspects in the plans that are particularly important from your perspective. And indeed, it's a plan that tries to strike the balance between national strategic autonomy and global and regional solidarity. One of the aspects that is important is innovation and digitalization, that we take full advantage in this, and making sure we leverage the benefits of digitalization for our global community of practice. And one of the aspects that stands out again is that of the importance of the health workforce. Thank you to the statement also, again, from the Council of Nurses, but also from the Pharmaceutical Student Organization, talking about the importance to involve and to train the next generation, but also to care for caregivers, for the EMT members, ensuring their safety and providing the psychological support that they need. Now, in terms of implementation, a few issues, three issues that stand out. First is knowledge sharing indeed is critical. It's a collective learning exercise. There are many different ways and platforms that have been created. The collaborating centers are one of them. I want to also appreciate Israel for working to increase the number of collaborating centers in this area, one actually at the Arca under development. Second aspect, of course, sustainable financing and resourcing is essential for implementation. So, as always, these plans, we are looking at them as documents that guide our actions, but also that can guide our advocacy and can help with our advocacy. And finally, the third issue is always around alignment. It's super important also with the Global Health Emergency Corps, with the GORE network, alignment at national level with the different aspects of comprehensive emergency response. And some of you have talked about the mobile laboratories. And you may recall that we had actually a side event leading to this regional committee meeting that specifically talked about that aspect. So in conclusion, let me finish by saying that EMTs probably embody more than any other area in the emergency preparedness our commitment to support communities when a disaster strikes. And this is why we were particularly keen that this is also the first major component of Preparedness 2.0 that we are translating a specific action plan. So we believe this plan, and we hope this plan will give a big boost to the already significant movement that we see in the European region. It is really a movement. There's a lot of a movement in this very situation. We've currently over 60 EMTs that are in the different stages of development, and it's growing. Today we got another few commitments from countries up and said here they also want to join the EMT movement, including Lithuania and Iceland and Turkmenistan and Czechia, and we're really excited about this. So we value greatly your support also that you offered today in implementing the strategy. It's very important. It needs to be collective implementation, including with our partners, and particularly, of course, I want to acknowledge IFRC here as a very strong partner in this field. So with this, thank you again for all your amazing work on the EMTs and for your collaboration in putting together this strategy, and we are very much looking forward to be by your side in implementing it. Thank you. Back over to you, Chair.
Thank you very much for the invitations, and I would like to pass the word to our regional director.
Thank you. And thank you, Gundo. I mean, that was an amazing comprehensive reply. So I think only probably 3 points left for me. So that in our region, we are very fortunate to have one of the strongest EMT networks globally. I'm very proud, really. wherever I go, this is being commended. And rest assured, I always try to move, what I call, it's one of my mottos, to move from good to great, to modernize. I want to thank Sweden here. I remember there was one meeting under the Swedish EU presidency on looking how to modernize, like with colleagues of Karolinska, and learn lessons to really be relevant. I remember there was one, I think, calamity where EMTs went, and actually the surgeons didn't have the work because it was done by the country, but it was primary healthcare service which was needed. So continuously we are adapting to really be at the edge of science. So we're going to continue to be like that. And then it's one of the key pillars of inter-regional cooperation. Always to have a look also beyond the region. And I want to thank here the European Union's agencies, also the Eurasia Economic Commission is very, very helpful in this regard. And thank you, of course, to you, Dr. Johanna Hanneveld, and your colleagues from the Robert Koch Institute for the strong support for that one. And we had a very good bilateral to see how we can further also from our side strengthen the sustainability even further also financially of the system. Thank you.
Thank you very much. I think we're coming to the conclusion of this. To conclude the agenda item, we're now ready to consider the adoption of the proposed draft decision contained in document EUR/RC74/conf/4 on emergency medical teams regional action plan 2024-2030 and its related costing. Now I'm asking the committee, are you willing to adopt the proposed draft decision by consensus? I don't see any objections. In that sense, I would say the decision is therefore adopted. Thank you very much. Thank you for this. For the next agenda point, I would like to pass the chair back to the president, to conclude our last session of today. Minister, the floor is all yours. Thank you.